The number of reports suggesting severe labor shortages in the healthcare field is proliferating. Some are suggesting there will be a national nursing shortage of 250,000 to 1 million nurses by 2025, in addition to shortages in other direct care occupations. To some, this means we will see healthcare quality plummet while costs rise. For others, the word rationing comes to mind. To the Healthcare Employers Council, it means nothing other than opportunity. It is an opportunity for West Michigan educators and employers to come together and build a brighter future for the healthcare sector. Instead of ignoring the problem, we choose to face it head on by identifying the problems and responding strategically in coordinated efforts so that our regional healthcare system continues to provide world-class care. This is why the Council has begun work on its labor planning and forecasting project. The purpose of this project is to manage the healthcare talent supply chain within the West Michigan region by 1. Forecasting the supply and demand for the few occupations that make up 80% of the healthcare workforce, using up-to-date employer data, and 2. Developing and executing strategies to meet employer needs for healthcare talent. Simply put, the forecast is about measuring which healthcare jobs will be available, when they will be available, how many will be available, and whether there is a sufficient supply of trained workers coming through the pipeline to fill those jobs. To accomplish this, employers are reporting quarterly numbers regarding specific occupations in the following categories: total number of employees within those specific occupations, the number of hires, the number of retires, and the estimated 3-month and 1-year change. Additionally, we are gathering data from educational institutions concerning key healthcare worker programs. Specifically, we are gathering past and present enrollment and graduation numbers, projected enrollment numbers, and estimates of graduates intending to enter the West Michigan labor pool. The analysis that comes out of the forecast will enable employers to make decisions to prevent market flooding and shortages, lower hiring costs, and increase retention. Similarly, educators will be given the market data that will enable them to expand or open new programs based on evidence of employer need, and to inform students of real and expected job openings. The benefits of this project are exceptional and come at a simple price: free. That's right, free. There is no external cost. The regional forecast will be released to the public and all stakeholders in the talent supply chain for free. Imagine what you would do as a stakeholder in the West Michigan talent supply chain with this forecast. Would you use it to counsel students on what career tracks hold a viable future? Show job seekers who it is that is training and hiring for growing occupations? Provide proof to policymakers there is demand for educational program expansion? Participate in a market strategy with other employers to retain talent educated in West Michigan? Use forecasting data to identify trends, allocate resources, or plan hiring blitzes based on seasonal demand? Or analyze how your company measures up against the region and its peer group on a number of metrics. However you use it, you will find the forecast will be an essential part of your strategic planning discussions. The other side of this project is focused on developing and executing strategies to meet employer demand for healthcare talent. Amongst the many strategies available, there are 2 we are currently focusing on. The first is encouraging educators to adopt and create career ladders within their own healthcare programs. Currently, most healthcare occupations are disconnected from one another in the sense of educational credit. While these occupations may exist within similar fields and much of the content may be similar, what is gleaned at the lower level doesn't apply to credits needed at the higher level. An example of this is that if someone earns an associate's degree in occupational therapy and functions as an OT assistant for several years, should he or she desire to become an occupational therapist, none of what was learned at the associate's degree level and experienced as an OT assistant will contribute to credits needed for a master's degree. This scenario occurs in several fields across the healthcare sector. Nursing is the exception. Within West Michigan, there are nursing programs that have clear milestones in which students have employable skills within months, which they can build on. This is a value-added model that lowers risk to students and facilitates immediate workforce engagement as they earn credentials on the career ladder. Our second strategy expands the career ladder concept and introduces the career lattice. While career ladders facilitate upward mobility, there is little room for horizontal movement. We ask the question, what would it take for healthcare professionals to move from one field to another without restarting their education? Drawing on inspiration from Khan Academy, and online learning environments, we are pursuing the possibility of tracking the knowledge, skills, and abilities, or KSAs, students learn in regular courses. Instead of defining professional programs by courses taken, they would be defined by KSAs required. Over time, students would develop their own knowledge, skills, and abilities inventory. Their professional coursework would be completed once their inventory matched career requirements. This KSA model facilitates horizontal movement because it tracks knowledge, skills, and abilities acquired rather than courses taken. The truth is, it doesn't matter if you learned how to insert a catheter as a physician's assistant, a nurse, or a surgical technician. It's the same process. Under the KSA model, a professional attempting to switch into a new occupational track who previously acquired the skill at an accredited institution would not be required to relearn it. If the KSA model were adopted, then a healthcare occupation could be mapped out according to the knowledge, skills, and abilities needed for optimal performance. Then another, allowing for the two to be compared, showing workers what KSAs they would have to pick up in order to move from one occupation to the other. This would open up doors for incumbent workers who find themselves dissatisfied with their current occupation, but don't have the time or resources to completely restart their education. Additionally, this would encourage cross-functional teams of diverse and qualified professionals and would allow the healthcare workforce to be more flexible in responding to the community patient needs. Maybe it's a radical idea, or maybe it's your next best practice. If you would be interested in receiving more information about this exciting work, or would like to set up a meeting with us regarding this project, please contact Labor Planning and Forecasting at afh.org. You can also view our 3-part slideshow on YouTube by searching HCEC Labor Planning and Forecasting Project Part 1.